Right. Thank you, everybody, for joining us today. And thank you, Stephen, for letting me know there are people here. So I will just get started. I'm going to share my screen just to kind of hopefully everybody can see that okay.
Yes.
Um, right, thanks very much. All right, so thank you for taking time out of your busy day today to come and listen to us and our panel on what should an auditing system for predictive AI look like. We've got two people here from, well, actually three, including me, from the PHAWM team. We'll tell you a little bit more about PHAWM, the PHAWM project in a moment. So I'm Laura White, I'm operations manager for the project. We also have Patricia Di Campli Sanvito, who we affectionately refer to as Paddy. And we've also got Eva Fingi, Fingy. I've totally ruined that, but sorry, Eva. Both of them are research associates on the PHAWM project. And I'd also like to thank Bob Purden, who has joined us today from West Dunbartonshire Health and Social Care Partnership. That is actually one of 27 partner organisations that we have engaged with on the PHAWM project. This is a project that also includes 7 academic partners. You can see them kind of listed at the screen at the bottom there. The University of Glasgow leads the project, and all 3 of us here from PHAWM are from the University of Glasgow. We were also hoping that Graham might be able to join us today. He was a participant in one of our workshops. Unfortunately, it doesn't look like he's been able to make it. We'll see if perhaps he might be able to appear a little bit later on. So just to give you kind of well, I'm going to give you a little bit of an overview of the PHAWM project. Before we get into that, I wanted to just give a word to our sponsors. Well, they're not our sponsors, they're our hosts. The Data Lab community. So many of you who are here will already be part of the Data Lab community. It's an online community of 7,500 AI professionals, students, and enthusiasts, and they run regular events and webinars. If you're not already a member, you'll see there's a QR code in the corner of the screen and you can join. It's a place to find like-minded peers, ask questions and gain support. It's free to join, and certainly the PHAWM project has really benefited for participating in this community. There is actually a part of the community that is dedicated to AI auditing. So that's somewhere where members of our team like to go and kind of answer questions and discuss the concept of AI auditing. The PHAWM project itself is sponsored by, well, is funded by EPSRC. This QR code, and there's the website link if you want kind of more details, but hopefully we'll be able to give you a quick overview of the project here today. The goal of this project is to develop workbenches and methodologies to help people who don't have expertise in AI audit AI applications. So this is, in particular, we're interested in making this a more inclusive process. So the people who would either be using the AI applications, so that could be organizations like West Dunbartonshire, or the people who are affected by the AI tools. So the people who are having their lives affected by the AI tools can be part of this process. So not just the people who develop it, although obviously they would be involved too, but the people who are affected by it as well. And the project is really aiming to make this a truly participatory process, both in the development of the tools and in the tools themselves. So that's something that Eva and Paddy will give you a little bit more detail about in a moment. There are 4 use cases in this project. So there's health and media content. They're looking at predictive AI applications, and cultural heritage and collaborative content generation. They're looking at generative AI applications. Today, we are going to focus on just the health. So one of the reasons that we're starting with stakeholder research is it's not possible to develop these workbenches without kind of having a better understanding of how the auditing process should be done, who should be involved, when it should be happened, what kind of questions that need to be asked. So the stakeholder research is really the underpinning for all of the development of the final tools that are going to be produced by PHAWM as time goes on. So Eva and Paddy, I'm going to hand over to them now because they're going to tell you a little bit more about the stakeholder research that they've done to date and the outcomes from that. So I'm going to stop sharing now and pass on to you both.
Thank you, Laura. Hello, everybody. Thanks for joining us. I will start the presentation. Okay, perfect. We have it. We have the slideshow ready. So, hello, my name is Eva Fringin, and I will start the presentation of our work, and Patty will continue halfway. So this is a summary of the work we have carried out as part of the PHAWM project. It's looking at participatory auditing of health-related predictive AI. Our goal is to empower stakeholders with participatory auditing, and to do so, we collected perspectives of end users and decision subjects who do not have AI expertise. We can move on to the next slide. As we are probably all aware, AI applications are currently ubiquitous in our life. They have significant impact on individuals and society. However, spectacular failures have been recorded in many occasions, such as blatant sexism in algorithms used to make hiring decisions, or perpetuated racism in algorithms used for bail decisions, and many more. They all highlight the need for responsible AI development. To mitigate these risks and harms resulting from AI applications, we need to ensure accountability, and to do so, regular assessments throughout the AI development pipeline are necessary. So the concept of AI auditing has been introduced. We can see a definition here that it is a systematic, independent, and documented process for obtaining audit evidence and evaluating it objectively to determine the extent to which the audit criteria are fulfilled. Although the specifics of the AI audit process can differ significantly from traditional auditing, the overall AI audit structure tends to follow a common set of stages: harms discovery, standards identification, performance analysis, and audit communication and advocacy. This structure has been essential in the design of the research we carry out with PHAWM. So if we look at the next slide, we have the AI application at the center of our attention. This is typically being audited by AI experts, individuals who have an AI background and often work within regulatory bodies or are AI developers themselves. They are supported by a growing list of tools which assist with various aspects of the assessment of applications, and these are often fairness related. However, they often encounter blind spots which might be reflecting their own cultural oversights. Or their social dynamics, or be due to the fact that they approach auditing outside of the context of use and everyday users. For this, a novel approach has been introduced to complement the work of AI experts in participatory auditing. And this is AI audits being carried out by end users and decision subjects, therefore people who will be using the AI application in question once it's deployed, or people who might not directly be using the AI application, but its decisions will have an impact in their lives. This is based on research findings which have shown that people without AI expertise have been effective at uncovering issues often overlooked by AI experts. But unlike AI expert auditors, participatory auditors are not yet supported by audited tools which are suitable for their purpose. And this is where our project comes in to develop such scaffolding tools. So if we look at the next slide, To explore this gap in research, we focus on how can we directly involve individuals without AI expertise in the whole AI auditing process, and how can we support auditors at each stage of a participatory audit through tools. In order to address these questions, we carried out a series of co-design workshops to collect feedback from potential participatory auditors. So we can see here our workshops looked at specific AI applications, which served as examples for participants to examine and assess, while their thought processes were being recorded to offer insights to help us with the design of a participatory auditing tool and methodology. The two applications we used were both health-related. The first one is SPARA, Scottish Patients at Risk of Readmission and Admission, which is developed and deployed by Public Health Scotland, and predicts a patient's risk of being admitted to hospital based on their health and demographic records. This is currently available to GP surgeries within Scotland, with GPs as intended users who might want to contact patients at high risk in order to prevent their admission to the hospital. And at the same time, patients are being the decision subjects, whose lives might be affected by the outputs of this application. Next, we have SAM, School Attachment Monitor, which is a research prototype which has been developed in the University of Glasgow and is not yet deployed. It predicts secure or insecure attachment style in children based on speech recordings. And the intended users for such an application vary, could be educators, parents, psychologists, or psychiatrists. Next. We can have a look at how we designed our workshops. They were in sets of 3. So first we started with the SPARA focusing workshops. We had 12 participants in total who represented potential SPARA decision subjects, therefore potential PHS patients. Once the 3 workshops were completed, we moved on to the next set, focusing on SAM, involving a set of 3 primary school teachers who could be potential end users of SAM. And again, we went through with all 3 workshops before the next set could begin, still focusing on SAM, but this time from the perspective of parents of young children as potential end users. Once each set of workshops was completed, we gathered the most important insights obtained from each and informed the design of the next set of workshops. This way, the SAM teacher series was updated based on findings from the SPARA series, and then the SAM parents series was updated after findings from some teachers' workshops. The topics we discussed in the first workshop in every series were the information needs of a participatory auditor. Like we asked our participants what information they would need to know in order to be able to audit the AI application in question. And then we explored impact discovery, which was mentioned before as one of the stages of an AI audit. And we invited our participants to come up with potential events, that is, potential outcomes of the AI application that could have an impact on individuals or society. For the second workshop in each series, we focus on prioritizing these events that were defined in the first workshop, and then coming up with ways to measure their impact by creating qualitative or quantitative metrics for them. And finally, in the third workshop in each series, we asked participants what they would need from a tool to support them in auditing. We showed them examples of sketches we were putting together for the design of the PHAWM workbench that we are preparing. And we asked for their feedback based on their needs as potential auditors. So once all 3 sets of workshops were completed, we ran an overall analysis where we extracted themes and insights from our participants in order to be able to structure a set of findings to inform our work, but also to contribute to the participatory audit research in general. And now I'm handing over to Patty to continue with the workshops. Thank you.
Yes, so talking now about like what did the workshop actually look like. So as Eva just said, the first workshop was looking at participatory auditing and what kind of information needs do participatory auditors or potential participatory auditors have. How we did that was we were presenting and explaining first what a AI development pipeline looks like a typical one that you can see here on the slide. And then we asked participants, what kind of information would you need at which point in the development pipeline to do an audit here? And people put then like post-it notes on this development pipeline, as you can see in the picture. We then asked them, when do you think an audit is needed and why at this point? And participants again put like different colors post-its on the development pipeline poster. And last but not least, we asked them who should be auditing. With more post-its on the development pipeline. Next, we were talking about impact discovery. So this is more about like what could or does happen when we use this application. So we asked participants directly to come up with the potential events, as Eva said, that could be like positive or negative impact that this application could have. We were also asking them who would be impacted by this implementation of the application and in what way. And then we went to the second workshop where we took the information that they gave us, the events they came up with, and we asked them, okay, now here are the events. How would you prioritize them in terms of like how likely is this event to happen and how much impact, the magnitude of the impact that this event would have if it happened. And then we asked them to think about how could you measure if this event was actually happening that you came up with. So we had different approaches on how people could do that. So the first approach was like discussing, like first thinking about things by themselves, then discussing in a group, and then trying to come up with like a measurable formula to kind of like evaluate if this event was happening or not. And then we introduced a more streamlined process that was helping people more in different steps throughout this process. And then in the third workshop, as I was saying, we were looking at support through a tool. What would an auditing tool have to look like to support participatory auditors through this? And in the first workshop series with Sparrow, we were kind of like co-creating user interfaces with our participants. We're like drawing things and like really discussing with them what they think they should look like. We then went away and made wireframes on top of that, which you can see here on the right side. And in the SAM workshop, we then went back to the participants and discussed these wireframes with them, getting feedback on what should be different, what would need more explanation, where would you need more information potentially to make this work for people. So we have a huge list of findings here, so we're just going to go shortly into them, but mostly like there are two types of findings we're going to discuss. And the first part is we found implications for participatory auditing involving stakeholders, any kind of stakeholders that can also be people without background in editing. As a matter of fact, actually one of the findings was we should include new types of auditors. So our participants wanted a huge range of auditors with all kinds of diverse backgrounds involved in this auditing process. They were also saying that internal audits, where mostly like the developers or the company that is developing the application is involved, is as important as having external audits. But the people are not involved in any form in the development of this AI application. And for external auditors, they were naming a whole range of different people who should be involved. That also included AI experts who are like outside of the company, but also domain experts of the field in which the AI application would be deployed afterwards. But also like regulatory bodies, end users, decision subjects, all of these people should be involved in the auditing process, where at the moment you mostly have the AI experts, even mostly internal to the company. We also saw that we should refocus the auditing process on more the AI application rather than the model, because currently usually the auditing is more on the AI model, and it doesn't really think about the impact that the integration would have on society or for specific use cases. So it becomes a purely technical evaluation of maybe accuracy and fairness, but you can't really look at the social and technical impacts, and that is something that was really important to our participants to think about this. We also should expand audits beyond the current time frame and scope, meaning at the moment, AI auditing is often done in the later stages of the development pipeline, so towards deployment. But our participants were really keen to have early audits. Maybe you have just the idea. We should already talk about it if you just have the idea, because that could already have implications. People could already have ideas of what this could have as implications for society, but very specifically in data preparation. So our participants were very interested in getting a lot of information about the data. Where does the data come from? How diverse it is? So here really they wanted also to be able to have a look at what are people doing at this stage. And this then all allows consideration of the social technical aspects. We should extend participatory auditing for generative AI. So we focused on predictive AI in health, as we said before. But now, as we know, a lot of AI applications are built for with generative AI. So we should extend participatory auditing, obviously, also to work for generative AI. And I think that a lot of our findings can work for either predictive or generative AI, but there will be some specific challenges or opportunities that generative AI might have that we haven't really looked at in detail yet. And then the last implication for the participatory auditing in general, we should support the entire auditing process. So at the moment, as I said, most tools only support auditing for specific stages or for specific aspects, like for fairness. But we really need a tool that kind of like supports the whole process from the beginning to the end, and is also usable by people without technical AI expertise or an auditing background. So we can allow participatory auditing for everyone. On top of this, obviously, we also have implications for the design of a participatory auditing tool that we want to share with you. So the first one is we need to provide information on AI applications in an accessible format. So that is also just not just the technical details. We need more information, like, for example, AI application purpose. What is it built for? The target users, who is it built for? On which data is it built for? Who was enclosed? Where did we get the data from? But also relevant regulations, standards, and policies, ethical consideration, usability, sustainability, all of these things our participants wanted to know. But these key concepts also have to be explained in enough depth for them to be able to understand and do an audit on it. But it has to be easily understandable, because we have people with very different backgrounds wanting to do this audit. Then we have to support assessment of both positive and negative impacts and their effects. So you might have seen that at the beginning, the stages of auditing had harms discovery. We changed that to impact discovery because our participant really wanted to also look at positive aspects of an AI application, and not just the harms, on which auditing these days is usually focused on. But they really wanted a balanced view of both aspects to be able to understand the appropriateness of this AI application. And they wanted to also be able to prioritize the different kind of events they came up with, to really see as like, to really balance the different kind of impacts that this application could have. We were using some taxonomies, and there are a lot of taxonomies out there, again, harm taxonomies mostly, but we think these should only be used as thinking tools, not restrictive labels. Because first of all, it's hard to kind of even classify positive events, but even not all negative events could be classified with typical taxonomy that are out there. And our participants actually, they were creating additional subcategories for that. So it should really be just a thinking tool, something that we can expand if needed, but it can support participants or participatory auditors to kind of think about auditing and what kind of impact the application could have. And then we need to design new ways to measure performance against impact as a basis for auditing. So it was really hard for participants to define metrics. So that was really something they were struggling with. So we need a really clear step-by-step guidance that participatory auditors can use to develop metrics, to actually be able to measure the events they came up with. And when we think about auditing the performance of an AI application, participants were very clear they wanted a visual component to kind of show them the outcomes of the metrics, so it's easier to kind of compare these aspects. But that obviously depends on visualization. These visualizations depend on the availability of the data and the model, which might not actually be there for the auditing process. And understanding that, our participants suggested there could be something like a conditional outcome. So something where they don't have to give, like, for the audit outcome, this is a pass or this is a fail, but something like, well, we don't have all the information, so conditionally would say we could pass, but only if this and this is true for the things we don't know right now. And last but not least, it's really important to engage the AI instigators with audit results. So the AI instigators are the people setting up the audit, kind of like instigating the audit, right? So some of the things we had that was that in the metric creation process, participants came up with some metrics that couldn't really be calculated at the time because we wouldn't have the data. We just wouldn't have the data for that. But that still gave like valuable insights into what kind of things are the participatory auditors actually interested in. Is this something that the audit instigator could take back potentially to the developers, or they might be the developers themselves, who knows, but things that they could take back and be like, we should think about these things, that could then add to accountability and also help mitigate potential harm that they might not have thought of before. But it could also be that they could start collect some data to actually be in a position in the future to calculate if these kind of events happen or not. So this was like a really fast tour on like our research so far and the findings we had so far. Here again, some information about the PHAWM project. The QR code would get you to the website. And that is our presentation for now. Let me stop sharing my screen.
Thanks, Patty. That was great. I've noticed there's a couple of questions that have come in already. I will get to them. I just wanted to I wanted to thank Graham for joining us. Graham, are you here?
Yes, hello everyone.
Hi, Graham. So Graham is a learning and teaching administrator at the University of Glasgow, but he's actually here today in his role as dad. He was a participant in one of the workshops that was hosted by Paddy and Eva. So Graham, it would be, and he participated in his role as a parent. So I believe the workshop focused on Sam. So I don't know if you wouldn't mind, Graham, saying a couple of words about your thoughts around the workshop that you participated in and the need for participatory auditing.
Well, it was certainly very interesting to see how the process came together. It wasn't something I was familiar with or had been involved in before. I don't have a background in, computing algorithmics, any of the kind of contributory elements to it. So yeah, it certainly was very interesting to see it. I found it useful in terms of thinking through the elements that would be involved in putting metrics together and to how these things will interact in order to evaluate the AI. In fact, there's my daughter right now. Sorry, carry on.
Yes, yeah, carry on. Sorry.
Oh no, I did. It was very much a new territory for me in terms of what I was experiencing and the things I was familiar with. So I was very much being guided by Eva and Paddy throughout the process. But yeah, it was certainly a new and interesting thought process to have to go through.
So is AI, the sort of AI applications coming into schools and when it comes to sort of decision making around children and the kind of resources that they might need, is that something that you are concerned about as a parent?
Not necessarily. You're concerned about it if it's not properly couched in processes such as this. It was not properly audited, and we're it has things inbuilt, such as, you know, the bias of AIs and the kind of processes that we're going through with this, or that we're testing with this, I think will be very, very important, because, you know, once you become aware of the extent of potential bias that are contained in AI tools of this nature, then you realize the importance of proper auditing and of ensuring that these aren't contributory factors to the outcomes. But AI, in the kind of limited back-end usage that was done in the study I took part in, doesn't concern me per se. I think used as a tool and with a correct understanding of the limitations of it, then it can be useful.
So an auditing process, though, could give some confidence to people that a tool is safe, or the harms are limited, at least.
Absolutely, but I think by the time you get to end users, particularly, for example, end users in my own position as a parent, you're almost operating on the assumption that these processes of auditing and verification have been done before it gets to you at that point. So I think it's essentially assumed. I don't imagine that many end users who were in the kind of position that I was in, not that I was in, but, you know, that I was representing, I don't think too many of them would be engaging too much with these questions of whether auditing had been performed and how auditing had been performed, and the results of auditing, you know, how effective that has been. I think as an end user, certainly in the position I was in, you would be making that assumption when you're presented with the process.
Okay, thank you. I think we'll move on now to Bob. Bob, you are from, as I said earlier today, you're from West Dunbartonshire Health and Social Care Partnership. You're one of the partners of the PHAWM project. It'd be great to hear your thoughts on this research.
No, and thank you for inviting me along today. As a partner, I think, and as a health and social care partner, I think the AI and AI ethics is obviously a critical area for us to kind of consider. And so the research around these tools and how they could be applied to end users are really, really important to me. And in fact, I think, you know, we first were made aware of this programme was a data lab event. Maybe 6 months ago or whatever it was, it raised our understanding of this. I suppose as a partner organisation who kind of classifies ourselves as the end user, you know, who will get to use these kind of tools, our current kind of world around AI, it's quite fragmented in that there isn't a lot of clarity around what is the best tools to kind of use. And I suppose when we started to look at this programme, it kind of fitted. It was very clear. We really liked the participatory features around that. It seemed to fit with our existing ways of working. We are very aware of using the Scottish approach to service design. And you know how that is very clear about using, you know, getting end users involved at the start of that process and building people into that. So when we kind of looked at the models and the features that you actually sort of provided, it kind of resonated where we were. There is a need. It's within our strategic documents. The AI is there, and we need to kind of build our capacity and understanding around that. The features around the non-technical part, you know, how you use non-technical people to audit, that really we found attractive. And when I'm kind of thinking about that, I'm thinking about health and social care services. We're integrated, so we have council services and NHS services, but I'm also thinking about our patients and how they could all be involved as part of our kind of panels, and how we would, you know, we could either. So as AI comes into our services and our programs, there's a lot of concern around AI, and I suppose one of the tactics and one of the ways of recognising the benefit. And I was interested, I think, I don't know if it was Paddy who was sort of saying, or Eva was sort of saying, that one of the things that the use identified was the fact that it's not all about the negative, it's also about the positive. And I think, we need to have, and change the way that we do things. And AI is one of the tools to do that. So we were very interested in how that we could use an upskill and a target and work with our local stakeholders as non-technical. And I call anyone who's our health people who are not involved in the AI world as those. So we could see a very clear pathway to engaging with and supporting our staff and supporting our patients, and hopefully developing a better and a safer service. So those were some of the kind of key things. We were also very interested in the fact that you've obviously got these tools which will hopefully be recognised as quality tools, but you also provide training for the auditors and then potentially certification. And obviously from a kind of governance point of view and a data protection point of view, that's really important for us as an NHS and a council, that we have quality audit tools where we can train up people to use those. And because it's a participatory model, it kind of very much resonates with the kind of things that we were wanting to do. Obviously the workbenches and the things haven't actually been presented, so we're very kind of keen that that we kind of were part of that conversation. And I think if you've got services which include patients, staff, and end users as part of the process, as I say, going back to the Scottish design kind of model, I think it will help that kind of transfer from an academic world into frontline services. And I suppose that's part of the reason we're interested in engaging and being involved with you.
Thank you, Bob. Yeah, so as Bob alluded to, and it might be helpful for the rest of the audience to understand, the next stage of the project is developing actual tools that allow these participatory audits to occur, but also we'll be working with the data lab to produce training so that organizations can and training and certification, hopefully. This is all kind of like a work in progress, but certainly the training, so that people can have confidence in AI applications. It sounds like Graham made some, there's some assumptions for some people, Graham, for instance, that before an AI application is used in an organization, that it has been through some kind of robust auditing process. And I'm certainly not an expert, but my feeling is that that's not always necessarily true, and that this is part of what this project is aiming to achieve. Paddy, could you say something a little bit about that? And then I might kind of jump into a few questions here.
Yeah, so I mean, we have seen many examples where people are like, oh, we're just going to throw this AI application at a problem, and it has not been properly audited. I mean, there are like huge examples in like in the US where they were using that to help like decide on how long people should go to prison for, and then it was found that like those models were highly biased, and we have these examples very often. And I feel like in the tech sector, we're always a bit more like, we're just going to put it out now to make sure people see that we had this idea. But then afterwards we think about, ooh, look at this impact it has now. So I feel like definitely there are quite a few examples. We see right now for AI as well, generative AI, these the social implications that AI companions have been having, or how these applications are set up. So there was probably auditing of the model, but not of the applications. So coming back to this point, not thinking about like, but how is it going to be used, and what are the potential impacts of that? So there's definitely a lot around that, where it's not all of the things have been thought of before it was just put out there for people to use.
Yes, and I would imagine it varies greatly, right? So there's probably not the same level of care in a private organization, a company, as there is for someone like the NHS. Would you agree, Bob? I mean, I sort of
Yeah, no,
the NHS is a lot more robust.
Yeah, I kind of agree. I suppose I'm also aware that when we're talking about the kind of AI and AI tools and the issues that go with them, it kind of still sits within our general governance around data. Data governance, it shouldn't be a separate type of thing. So within, we did a piece of work a couple of years ago where we developed our digital transformation strategy. Within the digital transformation strategy, there was a very small section on AI, because 2 years ago, a lot of the tools that we're talking about now today weren't even on the horizon. But out of that, we developed a governance process for any kind of new technology. So we've got a digital innovation group, which is a group that's open wide to any of our staff members, from health visitors through to GPs through to housing officers. Any of these type of people can do it, and so they can bring any kind of innovation to that group. That then comes to, we have a digital innovation board, which will kind of do the kind of DPIA type things. It'll do the audit, start an auditing process, and then from that we then pass that on to our kind of senior management through a PMO kind of structure. So what we would expect is that the tools, one of the tools and one of the options that we would have would kind of sit within, either the innovation group or the innovation board, and that would then work into our kind of engagement strategies around any kind of new innovation. So again, we are very aware that we need to protect the public. But we also recognise that we need to use technology to take the pressure off the NHS and council services.
Yes, so it's bringing in the advantages and mitigating the risks at the same time, right?
Yeah.
All right, thank you. So I'm just going to kind of jump into a couple of questions and comments from the audience here. I'm going to start going to go. Hang on, sorry, just bear with me a second, folks. There's a few things here, which is great. So there's a good question from Kevin Flanagan. He wanted to know about the involvement of domain experts and how you would go about making sure that their voices don't swamp out the other more diverse voices, particularly alongside lay people. So I think that's kind of a question about power dynamics, if I'm understanding that correctly. Eva, do you want to maybe tackle that?
Yes, so thank you for your question. Yeah, I think this is very important, and we have taken this into consideration from the beginning, from designing of our workshops. So we would never bring in people from different, but like some domain experts, along with people who are not domain experts, to have them all together work towards a decision, because they both represent. These are two categories of people who represent different things. So we would make two separate workshops: one for domain experts of a certain domain, and then just lay users who knows what each individual is an expert in, right? But in this particular occasion, they would just represent lay users or lay decision subjects. This is in the research phase. Now, assuming that the workbench is developed and the methodology that we are putting together is developed, in future use, that would again be separate. Our workbench would be, the goal is to make it easily approached by someone who has no expertise in technology, or by someone who is not a technology expert but has expertise in some other domain. They can all use it and provide feedback and audit an AI application. And then once they have input their feedback, this can be centrally processed so that every insight matters and is taken into consideration from the audit instigator or whoever is interested in to hear those voices. So nobody's voice will be muted, and they will not have to convince each other. Like the whole concept is that people from different backgrounds and representing different parts of the society can all have a say, which will then be fed into the plans for a particular application. I don't know if this answers.
Paddy's nodding her head vigorously. Is there anything you'd like to add, Paddy?
Just that, I mean, how we envision this is it's going to be a tool where an audit instigator who has an application that they want to audit, they can set up the audit. They're going to decide who they invite. They should make sure that the auditors that they invite are diverse. But at the moment, what it looks like the workbench is going to be is like every individual is auditing this. And it doesn't matter what domain expertise they have. The domain expertise is going into the events that they come up with, the metrics that they will think of, but the outcome they will have is equal for all of them. So there is no priority for domain expert that this outcome is now more important than the other one. So I think in that regard, everyone is equal. For like on the use of the workbench. What then the audit instigator does with the results, that is a bit up to them, but that kind of like depends then, I guess.
Okay, thank you. I've got a question here about Bob, wondering if you could say something about how to get your senior managers to commit to PHAWM and the idea of AI auditing. Because obviously it's great that you think it's a good idea, but how do you run that up the chain to make sure that you've got buy-in?
I suppose, yeah. So as I was kind of mentioning earlier, we do have a digital transformation strategy. Within that strategy, it was clear that AI was a tool that we wanted to explore. It is obviously, as part of that, we have done a range of engagements with our senior management. We kind of provide them regularly updates on changes on the AI kind of world. We are currently developing our guidance notes for our staff around this, which kind of reflects the AI Alliance's kind of playbook and this UK government's AI kind of playbook. So we're engaging with those. But we've also had speakers from the AI Alliance. So Steph Wright, who's the chief officer from the AI Alliance, to speak directly with our extended management team and senior management teams. And we've had, I think, Dr. Mark Wong, who I think's on the meeting today, to come along and actually meet with our senior management team. We're aware that AI is in our world. It's currently in our world. There's a lot of staff who are either now have access to Microsoft Copilot, or within some of our services like social work, they're actually starting to use specific AI tools. So to a certain extent, we're pushing against an open door, but it's about, so what we've tried to do is kind of have a range of ways. So having domain experts coming and speak to our senior management team, and also recognising that there is an upward pressure from our teams to actually see and use this. But the challenge we have is that not everyone has access to the same tools and things like this. So it's about managing that expectation. For us, some of it will sit into a procurement model, so that if we're how we raise this issue is around a cost benefit potentially to the organisation versus the governance and risk management that we have to kind of put. But with the pressure it's on NHS and councils at the moment, we are very keen at looking at issues, and so to a certain extent their senior managements are actually looking to us to say, is this a good tool, is it a safe tool for us to use? So it's as over the last 2 years, it's got a lot easier to get them to become champions for the programme, as long as it's safe.
Yeah, and I think this kind of idea of buy-in from across an organization is something that we've heard about in the cultural heritage sector as well. There's an element of the project needs to think very carefully about how they communicate the benefits of this kind of inclusive model of auditing, right? Of bringing everybody on board, because I think certainly in some sectors, there's this kind of feeling that, you know, this is something that experts do, right? And that you can't necessarily involve a wider section of the public in this process. So how do we make sure that we communicating to people that audits can be beneficial when done in this way? I just wanted to sort of look at this question from Chantel Davies. Is there a strategy for including people who may use assistive technologies such as screen and braille readers, or those who speak English as an additional language? I'm going to pass that on, Paddy, maybe? That's something you could answer.
Yeah, so overall, we are very, very keen on accessibility. At this stage, this is a research product at this, like we are still building like the first, the minimal viable product, like the very first version of this. And accessibility is a bit short in that because we're still trying to figure out how to how to get the functionality in, right? But that is very much on our radar, that we want to be as inclusive and as accessible as possible. But that will have to be built because there are still open questions about how to best build this tool. And we're not sure if we have the best idea of that yet. So there's going to be, there will be several iterations of this tool that we are building at the moment. And accessibility will be built in step by step, because at this stage we're still figuring out how to get the foundations right. But yeah, we are very, very, very interested in making it as inclusive, as accessible as possible, to also, I mean, allow participatory auditors to be from any kind of background, right? So yeah, we are very, very keen on that, but we're not there yet, but we'll get there hopefully.
Right, thank you, Paddy. Yeah, it's still early days, right? Minimum viable product is the starting point for this project. All right, I'm just having a look to see if we have any other questions. Oh yeah, and Mark's jumping in there. He's just saying we have considered things like color blindness and contrasts for the visually impaired. So it is something that people are aware of and thinking about, because it can't be a truly inclusive process if we don't take those things into account. I just wanted to have a quick look and see if we had any other questions. We had one about the SAM. Somebody was just curious about what you meant by attachment with regards to children, and is that simply difficulties of some children to leave parents when entering the school class, or I'm not familiar with SAM. Eva, do you want to jump in there?
No, thank you. Yes, please. So when we say attachment, we mean a psychological term and a whole concept which refers to a specific bond that infants actually develop with their primary caregiver, and this bond is then influential in their lives and the bonds they will build with other people in other relationships in their lives. So it's a technical term used by psychiatrists and psychologists, and for someone to get a diagnosis of secure or insecure attachment, they would need an expert to do so. The specific application that we use for our audit is just serving as a screening tool to point to occasions that seem likely to be diagnosed with insecure attachment, but need to be assessed by a professional. So it is not a definite answer whether a child has secure or insecure attachment. This is something a professional psychologist or psychiatrist will be doing. So yeah, this is a very technical term. Thanks.
All right, thank you, Eva. We've got time probably for one very quick last question. So the question here is, when West Dunbartonshire look to start using auditing, will it be with specific use cases such as Copilot? So I think many of us have started to use Copilot, Microsoft Copilot, in our working lives. Is that something that you can speak to, Bob?
Yeah. Again, I think what we are very aware is that we need to probably start small. The Microsoft Copilot is a product that probably a lot of us have access to. The reality is, I think for ourselves, is we're probably going to be looking at an AI tool that is being currently used across, I think, the UK for our social work teams. A specific one's called Magic Notes, which is a transcribing AI based on a phone, where the social work officer and our client have a conversation that is then recorded, transcribed, and then put into the appropriate fields within their different templates. And my understanding is it's heavily used. I think 60% of the social work teams in England are using it, and it saves approximately a day a week for social work teams. So we're experimenting with that at the moment as our kind of first use case. We have to go through a whole host of governance to do that, because we're integrated with the council and the NHS. We're having to use council governance processes. But I would hope that once we get an MVP, that our first one wouldn't necessarily be the Copilot, because that's already been decided, in the sense that it's already in our ecosystem, whereas the Magic Notes is a good use case for ourselves. It's targeting a specific part of our services, so it's the children and young people's services, and even within that, we're not necessarily even targeting the services. We may be using it within the staff within that as a starting point. So again, what we're very aware is we need to probably start small, but we think by targeting a very specific use case, then, in my head, it's like, going back to the non-stakeholders. So that would be social workers, it would be clients of social workers, it would be managers of social workers, and any other related people around those. So yeah, we've already got a number of AI tools that are currently within our world that we're probably kind of looking at. But again, for us, it goes back to our structures around it. Probably come in through our digital innovation group, digital board, and then into our PMO type world, and then we would decide. And again, for us, we might go through our NHS engagement pathways or our EQIA pathways to identify how we might use tools. But so yes, we've probably got at least one clear use case that we would probably want to use the platform for.
All right, thank you, Bob. That is great, and we are actually out of time. So I'd like to thank everybody for coming along today to listen, and I'd like to thank Paddy, Eva, Graham, and Bob for taking part in this panel. I'd also like to let you know that on the 14th of October, there's going to be another online talk on digital innovation in diabetes care. On the 22nd of October, there will be at the Barclays Eagle Labs in Glasgow, a discussion on the future of healthcare systems. And on the 30th of October, there'll be an online talk on breast cancer and AI. So these can all be found on the Data Lab community events page. Please do sign up for them if you're interested. And I'd like to thank Stephen for helping us to get organised. It's been really great having this session today. So thanks everyone. Take care and goodbye.
Thank you, everyone.
Bye.
Bye.